Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
And welcome back. Once again, a big thank you to Fulltech for sponsoring this segment. It's actually our COVID-19 update, courtesy Fulltech Systems. In with us, we've got Dr. Marvin Manzanero. He's on the screen, of course, and he did suffered with COVID-19 and is in the recovering process. Dr. Marvin Manzanero, it's so nice to see you, sir. Good morning and welcome.
Good morning, Marlene. Good morning, John.
You're at a different background, and that's definitely refreshing for us because we're so used to see you behind a cement wall. Like, man.
In front of.
Oh, in front of a cement wall, indeed.
Josh.
But Dr. Manzanero, let us get on into it, man. You contracted this virus, something that you've been talking about. For me, it like when I heard it, I was like, what? Dr. Manzanero can't catch COVID, but enough to say that he did. What was that like for you? What happened when you found out? What was that experience like?
Well, I really don't know where I got it to begin with, and I think that's something that we need to stress for everybody. The first, I remember a Friday. This Friday is going to be 4 weeks. I started with an itchy throat. And I was feverish. So from the moment I felt that, I started to kind of isolate myself at home. That was a Friday. Saturday, I didn't really have any symptoms. Sunday, I didn't really have any symptoms. Monday, I went to work. And towards the afternoon, I started feeling a little bit weak, I think. And I had a public activity that afternoon. I didn't go, and I went to get a rapid test on that Monday evening. That Monday evening, December 7th, I think is the date. And the result, I was driving back home and I was told. So from the Friday when you start having any kind of symptom, and because COVID is so prevalent now, that's one of the considerations. And with COVID being unpredictable the way it is, there's lots of things that can go through your mind. So you hope that you can have a mild process that is not going to go anywhere. And as I said, my only symptoms when I started was the itchy throat and the fever I had on that Friday.
Doc, did anyone else in your family get it?
No, because as I said, on the Friday when I came and I started feeling that, I started wearing a mask home. Yeah. I isolated myself to a certain degree through that weekend. And after the Monday when I got the result, then I went into isolation at home.
So you got your results that Monday, and as you said, you started off with just the minor symptoms. We know that you were eventually hospitalized by the end of that week. Tell us about how things deteriorated and how quickly.
Yeah.
Well, there's phases, and you read. I've been reading every single day about COVID. So on the Tuesday and Wednesday, I was really just kind of watching what was happening with myself. I was really just on the basic medications, ibuprofen, vitamin supplements. I think I was thinking zinc tablets. Nothing else. I wasn't having any symptom. On Thursday, just 3 days after being diagnosed, I started feeling maybe a little bit more tired, but still no fever. On the Friday, I started having a little bit of fever, and so I started antibiotics on that Friday. That was the Friday before I went to the hospital, and I was just tired. I think that's the thing that usually comes about, is just being tired. And on the Saturday, I think I was a little bit more tired. And I have a watch that tracks your heart rate and those kinds of things. And my heart rate was going a little bit high that Saturday morning when I wasn't feeling too well. So that's when I went for a CAT scan, and then I went to the hospital.
Yeah. You had pneumonia.
I had infiltrates on both lungs, in the bases, and some were starting to appear on the upper portion of the lungs.
Sorry, Doc, I don't know what that means. It infiltrates.
Yes.
Infiltrates is small lesions, and as if you're going to be having a viral pneumonia
Okay.
in both bases, and they were starting to spread to the upper portions of the lungs.
Wow. And
And mind you, I wasn't really having shortness of breath.
well,
I
that was
just-
going to be my next question. Did you have, you didn't have a cough, you didn't have shortness of breath, you just
No.
noticed your heart rate. And that's because you wear a tracker.
Yeah, but I was just feeling tired. I wasn't feeling myself. And maybe that's one of the things that gets me a little bit emotional, I think, is that, and I still have had to struggle with it coming back home.
Yeah.
Is that on the Friday when I was taking a shower, I felt I was going to crash.
Wow.
Something wasn't right. And I came out of the shower and I was just I felt like like I had just run 5 kilometers at full speed. Something wasn't right. I just couldn't describe what it was.
Yeah.
And so, but I went to sleep well. I never had any problem sleeping. As I said, I didn't really have shortness of breath. On that Saturday morning, actually, when I went to do my CAT scan, I wasn't so sure if the heart racing was because I was anxious. And so when I called the doc for the CAT scan, the doc said, just come and get it done now. I mean, that's better than an x-ray. And so I had somebody drive me to Belmopan to get it done. I wasn't thinking, honestly, that I was going to see anything in the CAT scan. So as soon as the CAT scan was done, because you're a professional, I guess, I went in and sat with the radiologist, and he says, "Do you have COVID?" I say, "Yes, I have." I said, "Okay, look at the lesions." And then even though I wasn't feeling that sick with that CAT scan that I saw, I decided to call the doc in Belize. They said, I have to come in.
And you spent a week in the hospital?
I was there I got there on a Saturday, maybe around 2:30 p.m. Carhushner initially. Then I was taken to Healthcare Partners. When I got to Healthcare Partners, I was really feeling very sick. I was having high-grade fever. My blood pressure had gone up. My glucose level had gone up. And I have never had high blood pressure.
Yeah.
My heart rate very, very high. And I was hospitalized on the Saturday. Sunday I was feeling better. I actually think I only had 3 days of fever, because after that Saturday when I got fever, I did not have fever again. Up until today, I have not had any fever.
Yeah.
What was going
So-
through your mind?
Yeah.
You know, you're a physician. You understand the severity of the illness. You've been teaching us all about the severity of the illness, and you start to see these symptoms, the effect on your lungs, and the changes in your blood pressure and glucose levels. What's going through your mind?
It's a difficult process that you have to be able to digest even today. I mean, I think that mentally it takes a toll on you. Emotionally, it takes a toll on you. Because when I went Saturday to get the CAT scan done, I can tell you I walked out just with, I didn't take anything with me. I mean, I took my mask, I took my wallet, and I just went for my CAT scan. I wasn't thinking I was going to go from there to the hospital. When I arrived at the hospital, I arrived with just the CAT scan and the clothes I had taken when I left home. And you don't tell anybody. Well, I mean, I didn't tell anybody. I just said I need to go get this study done, and then we'll take it from there. And then you have to call back your immediate family members to tell them what is going to happen or what you think is going to happen. From the moment you see that CAT scan, the first thing that went through my mind is, okay, this can either get three things. It can get worse, it can stay just the way it is, or it can improve. And you know also that there is no specific medication, so it doesn't really matter what they may give you or not give you. I mean, it's kind of difficult to determine where a patient is going to go from there. So, as I said, Saturday I wasn't feeling too good. Sunday, when I was in the hospital, I was better because I didn't have any fever. And then Monday, I think I was gradually improving. And then when you get the respiratory therapist coming on the Sunday, and I recall the first test they did on me, I had 30% lung capacity on Sunday. There's a little simple test that they do to find out how much.
And you're a runner. So
exactly where I wanted to go.
You have pretty strong lungs.
Yeah, I think.
And that could have been a reason why also I didn't really develop respiratory distress. Why the only symptom that kept coming on was that your heart racing. I mean, your heart just being fast. I mean, my resting heart rate when I'm sleeping, according to the chart, is around 52. And so even during the day, my heart rate doesn't go beyond 80. But that Friday, Saturday, we're talking about 110, 112, 118.
Wow.
So let me, here you are after, what is it, since almost 10 months of talking about this illness, and you were hospitalized looking at a viral pneumonia in both lungs, caught it because of your professional expertise. You caught how far it was based on your professional expertise. You went and got tested. I mean, if you didn't go for the CT scan, you don't know what would have happened.
Yeah.
I mean, you said in your post, and I think it's something that still stands out to me, that you pretty much thought you were going to die.
Wow.
Well, this is my second time in an ICU, in 2012, when I had hemorrhagic dengue, and I had 5,000 platelets and required multiple transfusions.
Wow.
I went through a similar process, but this time it felt different. Because, I mean, for me, it's because I felt much more vulnerable. Because knowing that that's how COVID-19 is. It's so, I have called it unpredictable and unforgiving.
Yeah.
As I said, even when I was in the hospital, I think, and I'm trying to document all of this, because hopefully it's going to help somebody. And that's one of the reasons why I also succeeded to give an interview, because it's still difficult for me to sustain long conversations.
Yeah.
But it's on the Tuesday, for example, in the hospital, I remember I was much better. On Wednesday, I believe my lung function had improved to about 70% with that simple test, doing respiratory exercises. But on the Wednesday, Thursday, I mean, the Wednesday I wasn't feeling good. I just had no energy. So you go from having a very good day in the hospital to Wednesday not feeling too good. Then you have to stay another day in the hospital. Yeah. My lab exams, when I was discharged, improved. They kept doing an X-ray every day. There was no further changes. But when you get discharged on the Friday, you also have to go through an emotional process, a mental process that you struggle with every day. I mean, it's not only the physical, it's the mental. Sometimes mentally you want to go somewhere and your body doesn't allow you to go. And some days your body physically may be able to go somewhere, but mentally you still struggle.
Yeah.
So I think those processes, and I know for even males in Belize, because that's how we are, we are not perhaps reaching out to persons. And I think Marlene mentioned the term long haul. In the reviews I have been doing, again, COVID-19 related, because we learn something new every day.
Yeah.
There's a term called long haulers, where people are just sick for extended periods, for weeks and for months.
Yeah. And
I
face
was
residual effects of the virus for a very long period of time.
Yeah, well, I went for my control CAT scan yesterday. I'm going to visit my doctor later on today, because there is some scar tissue that remains in both lungs. I don't know how much of that is going to regress. It doesn't seem it is going to progress. And so you'll have to learn to live with that scar tissue.
Yeah.
But it's also, as I said, even, I mean, I guess that's mentally, I think I've always been a strong person, but there's days that can be very dark.
Yeah.
Well,
Even the Friday when I was
isolation.
discharged.
That's what I was going to ask, because we interviewed a number of COVID recovered patients and people who actively had COVID, and I think what I hear repeatedly is the mental challenge that it takes. One person reported having hallucinations. The other had as many as 3 panic attacks during her time. A nurse told us, the scariest part of the isolation is feeling symptoms and going to bed thinking, I'm not going to wake up. So the emotional and mental toll is one perhaps that we don't discuss enough.
Yeah, well, I mean, I had insomnia, and I have always been a very good sleeper. That has improved. I have had anxiety, yes. I had a Wednesday of last week, a severe attack. And as I said, mentally, I've always thought that always a very strong person, and I don't know where it came from. I mean, you're just not there. I think it's just your brain takes it flashback time, and just general fatigue. As I said, the Friday when I got home, I think I can say I had a breakdown emotionally.
Wow.
And one of the things I have had to.
Why do you think that happened, though, going home?
Well, it's because you come home. That's one. But as I said, one of the items I've had to.
Because you feared that you wouldn't?
Yeah, from the day I think from the moment I saw the CAT scan, not when I was having the symptoms. When I saw the CAT scan, as a doctor what's going on. As I said, you don't know it can progress, it can stay the same or improve. So you can have your life flash before your eyes when you're seeing a CAT scan, yes. Yeah. I mean, the radiologist doesn't have to explain it to me. I know what I'm seeing. But it's also, one of the things I've had to deal with a couple of days is, and again, you don't know where these things are coming from, is I felt on Friday afternoon, and it was raining, and I don't like necessarily rainy days, so that doesn't help my mental status. I felt extremely guilty for being sick, for having contracted the virus. So as part of the mental process, you also have to be able to go through on a daily basis.
Why guilt?
I don't know.
Wow. But Dr. Manzanero, we do know indeed that you try to balance your health, especially physically. You're a jogger, you're a runner, and I put myself in the same category for we go for miles. And with that said, there are a lot of people who actually feel that way. They jog, they work out, and then we take it for granted that, COVID-19 is here, but I'm healthy. taking it for granted. Why should they not, or why should we not do that, especially being that you went through this experience?
Because I think it's unpredictable. I'm in my 40s. We also assume that the older you get, the unhealthier you get. That's the persons that are going to be going through the difficult processes. And that's why I've said it's unpredictable. I have never had high blood pressure, for example. And my blood pressure decreased significantly as I went through the hospitalization days. Things just, COVID can do that. I was talking to a colleague, for example, from Mexico, who had COVID in August. She's a pediatrician. And now 4 months later, she has post-COVID-19 syndrome, where she has fluid around the heart 4 months later as a result of COVID. Also somebody who was previously not ill. And so she can't even dress herself now because she gets tired just by dressing up. You don't know also what kind of scar tissue is going to stay. I can't climb the stairs. I get fatigued. I have to climb the stairs in 2 or 3 phases. And as I said, there are some days when you're able to do it, and some days when you're not able to do it. So I call them yo-yo days. And it's a long haul. There's lots of processes that need to be resolved physically, mentally, and emotionally.
Yeah. We're looking at over 10,000 people confirmed with this disease, a percentage of that who suffered mild symptoms, and some who ended up in the hospital like you. I think KHMH, at least, their numbers when we spoke to them last week was somewhere around 165 people had been hospitalized. Doc, what has this experience taught you about COVID? And there's what you read in the books, there's what you heard from all the medical experts, and then there's your experience. What has it taught you?
One is that the virus is not to be taken lightly, that it can really affect anybody at any age, and you don't know who, despite all the precautions. And now you're hearing of a new strain that is 70% more contagious now in the US. It is just not necessarily going to get any better, and I don't want to be pessimistic. That even though if you have caught COVID, the new studies suggest that you may develop immunity only for the next 8 months maximum, 6 months. Initially, it had been said 3 months. So you still have to take all the precautions. I believe also that there are some people who perhaps never made it to the hospital, who had respiratory symptoms and kind of just stay put home, who may be having the same scar tissues that I am now finding in my lungs. But scar tissues also mentally. I think we should be able to be a supportive community, to not so dismissive of our family, friends, neighbors that are ill or take it lightly. We have to learn to live with COVID. And I think for the people who have survived it, you have to learn to survive with COVID because, as I said, mentally, I think people can be thrown into depression very easily, especially males. So I think we need to be on the lookout for them as a community, as family members. I am on the lookout for my own signs and symptoms, but because I know as a clinician what I can expect, but there might be people out there who don't know what can happen. And as I said, there's anxiety. Being able to acknowledge that on Wednesday of last week, it was a horrible day for me. Monday of this week, it wasn't a good day.
Did you have anxiety
And I remember
before?
those days because
Did you have anxiety
Say again?
before? Did you have anxiety before, or this is
Never.
since COVID?
No, since COVID.
Yeah.
Which
And I have wanted to not necessarily be on medication, but there are days when you have to be on medication.
yeah.
See, and I think that this is one of the things that I have read about. The impact of COVID on individuals, it can affect just about any part of you. You know, you've heard from circulation to mental fog to memory issues to anxiety and depression, long-term fatigue, kidney pain, back pain. We've heard so many different examples of things that can be a part of the residual effect. And let me ask you just clearly, what are some of the things, even though you passed 14 days, so you are recovered, but you're still experiencing the symptoms of the illness?
Yeah, I am at, from when I started with symptoms, I would be at a day 26 now.
And what are
when
you
I-
still experiencing now?
I get tired very easily. Not very easily, perhaps but Monday I got tired climbing the stairs very quickly.
Yeah.
And so after I started developing anxiety, Monday night. So yesterday I walked much slower than before, than the other days, because I was afraid of triggering what I felt on Monday when climbing the stairs, because I got short of breath very easily and your heart starts to race. So I can't walk that much. I think since I have left the hospital, the maximum amount of steps I have taken in one day is about 5,000 steps. That would usually be the amount of steps I do in one run when I used to run. And, the insomnia has improved. The anxiety is still there. I've not been able to put on any weight, even though I'm eating regularly. I never really stopped eating, even when I was in the hospital. I ate less, perhaps, but I mean, I get hungry, I eat. I lost 19 pounds when I was in the hospital, and I have not recovered any weight. So I think it's lots of things that get affected. Whether this will be a long haul thing for me, I think it is. Looking at the CAT scan from yesterday, there is some scar tissue there. I think I'll have to learn to live with that. I have to do much more respiratory exams.
You know,
See when I walk.
the entire country, I think, has been sending you healing thoughts and wishes since they knew you were diagnosed with COVID, and of course when you were hospitalized. I can't imagine, having held the position that you did, what perhaps went through your mind when you think, I mean, at this point we've lost 241 people to this disease. People, it doesn't even matter the age, people who, if they didn't get this disease, would still be here for this holiday season. And you see for yourself, you experience for yourself just this rapid progression that, had you not had your medical background, Doc, maybe you wouldn't even have gone to the hospital and be preventative or proactive in your actions. When you think of just how sly COVID-19 can be and sneak up and really cause severe symptoms, I mean, how do you translate that into a message for the public after your experience?
I think you have to listen to your body. That's what my message would be, because people say shortness of breath, I know, is one of the more common reasons why people would go to a hospital. But if you're just not feeling, or if you're getting progressively worse, a fever that just continues to be high despite medications, the cough, that you're getting fatigued when you're doing normal activities, or your heart beating too fast, and you can check your heart rate yourself. I think that's when you need to seek prompt attention. Some people will improve just with oxygen therapy. Some people will require IV antibiotics to avoid further infection, which is what I got. Because when I came out of the hospital, I was still on steroid treatment, antibiotics, on anticoagulants, and I'm still taking medications. I think it's being able to listen to your body. You should know your body better than anybody else. And if you have any chronic disease, then diabetes, hypertension, make sure that you're taking your medications constantly. That those never, I mean, besides COVID, you always need to be taking those medications because those can complicate it rather quickly. And is going back to also what Marlene had said in terms of the countless messages and thoughts and prayers and well wishes. After I posted on the Tuesday after I was diagnosed, I didn't really go back to social media until maybe 2 or 3 days, 2 days later. On the Thursday when I started feeling sick, and then you see the overwhelming amount of comments and messages, which I haven't even gone through all of them, sent to my inbox. And that takes an emotional toll as well, because I can never be appreciative of all those things that people have sent. Even in the hospital, when I was there, the lady who cleaned the room, she would bring me vervain tea, I think. Warm vervain tea. She came into the room to clean it 3 times a day, and she would bring me tea, warm tea. And the day she wasn't working, she sent the tea for me. And the day I was leaving the hospital, because I left around midday, she came in and was maybe as happy as I was, dancing into the room. So those things, I think, emotionally also take a toll on you. And then when I was hospitalized, I don't know how it got to the media or who leaked it to the media, because they said they called my family. But I was just being hospitalized when I was already getting lots of messages. Then my subsequent posts on social media have just generated lots of WhatsApp messages from people I don't know, from people who tell me, you don't know who I am, but this is what we wish for you. And we are appreciative for the work that you have done. So those certainly help. You can read back those comments on the gloomy days. But that's how it is. I mean, there's a lot of support I've gotten from different people. I had somebody, an ambassador, call me on Saturday, I believe. And the person was crying on the phone just because I had been released from the hospital.
Wow.
So I think those things help, but they also take a toll.
Dr. Manza,
Positively, that is.
Belizeans generally do and genuinely do love you. Belizeans love Dr. Manzanero. Seeing you every day and you telling us what to do, what not to do, and that's actually helping us. So we developed that genuine love for Dr. Manzanero. But I just wanted to ask, when you contracted COVID-19, did you feel compelled to put that on social media? Did you feel like you had to do it, or it was just, you know what, let me just tell everybody? Was it, I feel like I need to do it, or I just wanted to?
I think for me, even my posts, like I did one on Monday when I was just scrolling through the tablet, realizing that I had not even listened to music in 3 weeks. I had no energy to even put on music. It's just not there. There's nothing. So the posting I had done initially after I became ill was, and even my posts after I left the hospital, anything I have done is to try to create awareness so that people can understand that you may take all the precautions and you don't know where you got it from.
Yeah. Yeah.
That Marvin Manzanero, at the end of the day, is a human being just like anybody else.
Yeah.
Um, Marvin Manzanero right now is the patient on sick leave that has a doctor's appointment later on today.
Yeah.
So it's the vulnerability that I wanted to stress, the awareness, especially because males in Belize tend to not consider themselves vulnerable. And I think one of the things I also want to be able to stress, especially as you go into a new area, is that you have to learn to appreciate the simple things in life. Not that I wasn't doing that, but then, I mean, for what, 10 months,
Yeah.
I was sleeping well.
Yeah.
My phone never stopped ringing. Even when I was in the hospital, people that don't know that I was in the hospital were still seeking advice. I didn't eat well for those 10 months. I had stopped running, and well, there was lots of stress.
Yeah.
So you have to learn to appreciate those small details in life, and that's where my posts are tailored towards. That's nothing. The public figure that people who know it's a personal note, if you will.
Yeah. And Dr. Manza, I think, the Belizean recognize that. They know how much you worked to keep us updated. I know from the media standpoint, there's no question that you wouldn't answer. And in fact, whenever we asked for updates, you would provide them. So we knew you worked around the clock. But let's put this all into perspective now. One of the things I'm sure you're bombarded by is, what did they treat you with? Did you get the convalescent plasma? People are very much eager to know and understand what makes some people survive when they go into the hospital, and why some people don't.
I don't know what all they gave me. I was a patient. I know that I got medications for fever. I was already on citromycin when I got to the hospital. I was given another antibiotic IV. I was given famotidine, which is something that's used in other places. It's an antacid, proven to be on some benefit. I wasn't given convalescent plasma. I know that was discussed on the Saturday when I arrived. I believe I was given remdesivir. I think that's what I got. I might have been getting the usual medication. I was on steroids, of course, dexamethasone.
Yeah.
And I was on heparin to prevent any clots from forming, which are the same medications I was discharged with. I was discharged with aggressive antibiotics, steroid therapy, and anticoagulants. And other than that, I'm taking right now vitamin supplements. I'm taking melatonin. Occasionally, I take anxiety medication. I think that's about it right now, because there's nothing really that can improve that scar tissue in the lungs. I may be getting a pulmonary test, function test later on today, to determine how much function there is and what I can do to improve it, and what I'll have to learn to live with.
Yeah. So we know you were hesitant about coming back to the media, but you outlined, as you said earlier, it was more important to you to speak about this experience so people understand how COVID can affect an individual. What's your message to Belizeans? We are seeing steady increases, or steady every day there are new cases being reported. We are still hearing from all officials a plea for people to take the regulations seriously, to not gather, to wear the mask, to sanitize. How do you take your experience and try to drive that point home?
Yeah, I know I had been invited to be there on the Tuesday,
Yeah.
yesterday,
Yeah.
and I said no. Monday I had a horrible day,
Yeah.
and it has taken mental preparation to be able to speak. Even the interview I gave for BEL on the weekend, I mean that I had to take a pause 2 or 3 times because I get short of breath sometimes, and I also get um, I go through mental and emotional processes. So I have to prepare for this. Um, my message is you have to stay safe. You have to always be on guard. This is not going to go away. The new model suggests that this, if is an endemic
It's going to be
situation,
endemic.
the
Yeah.
current numbers might continue to increase until 2023. So you really just have to take care of your loved ones, and you have to make sacrifices. We are living under a new norm. I don't think we're going to go back anywhere or anytime soon to where we were before. And even though vaccines might be on the horizon, you can't consider that that is going to solve the issue. You will have to have good amount of your population vaccinated. And as I said, even if you get COVID-19, it doesn't mean that you will no longer be able to get it. I mean, you don't know what happens if you get it again. And so you really have to stay safe. And I really wish that nobody will have to go through what I have gone through. I think that's one of the things that I keep stressing. It's just been a difficult process. So you really have to take care. You have to take care of everybody around you. This is so unpredictable. And you have to assume that everybody you meet on the street is a COVID-19 patient.
All right. So you are on sick leave until when?
I am on sick leave right now. I am going to see the doctor today, and I guess it depends on the pulmonary function. Because as I said, I can't climb a flight of stairs, and without getting tired. So everything is kind of in slow motion for me.
Thank you for joining us, though. Like I mentioned, Dr. Manzanero, Belizeans genuinely love you, and we can only wish you all the very best. And thank you. Thank you, actually, for your work. Thank you.
Thank you, folks, for all the support, the messages. It's really appreciated.
All right. Well, you take care of yourself
Yes,
and get that rest that you clearly need. And we do hope that you start feeling more like yourself sooner.
Get back on the road to jog.
Yeah. All right.
All right, Dr. Manzanero, once again, thank you so very much. Great conversation there with the great Dr. Marvin Manzanero. But Marlene, we're about to take a break, and when we come back, we'll be chit-chatting with a Belizean American who is a coding instructor, and she's doing some work for some Belizean students. We'll talk to Brittany Leslie when we come back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.